want to start off by just talking about medical conditions and driving and what the issues are. Because it is when you're talking about quality of life, when you do quality of life surveys with people living with epilepsy, the main primary one that you can have an effect on is driving. If you can get somebody to be driving, their quality of life improves dramatically. Well, what are some of the conditions and some of the issues? Well, lapses of consciousness is the driver. I love this quote from George Burns. I want to die peacefully in my sleep, like my grandfather did, not screaming like the passengers who were in his car. So, lapses of consciousness are the prime mover, and I'll actually recite the law in a minute. But there are other reasons, that for people to have their driver's license suspended. Dementia, obviously diabetes, where you have episodes of hypoglycemia or hyperglycemia where they can affect consciousness, Alzheimer's, drug use, pulmonary issues, obviously things that can impair consciousness. Now, not all blackouts are seizures. And a survey that was done showed that when looking at a group of patients who had loss of consciousness, only about 38% of them were seizures. Other issues were fainting, insulin overdoses, heart conditions, strokes, other things that can affect cognition and consciousness. But we make a big to-do about seizures as a cause, and it's almost discrimination. I think that, and I'll show you some data at the end that really points out this is really a form of discrimination. So, of all the seizures that occur behind the wheel, about half of them don't cause a crash. So either there's enough warning or the nature of the seizure is such that the car just slows down and stops, maybe stops in the lane. So we are in a state of only 6 in the country that has mandatory reporting. It's not a choice for your doctor. It's a felony if we don't report you. You're in jail and $25,000 fine. And only 6 states, and they're labeled here. So it's a mandate that came from California law that we are obligated to notify the public health, who in turn notifies the DMV of anybody age 14 years of age or older who in the previous 3 years has had an episode of loss of consciousness, where there are certain other qualities that have to go in that, and then eventually is notified to the DMV. Here's the rules. Every physician and surgeon must immediately report to the local health officer individuals whom they have diagnosed as having a diagnosed as a disorder. So that means you have to come up with an actual diagnosis characterized by lapses of consciousness. This is defined in 14 years of age or preceding 3 years, as I mentioned. Experience 1 or more occasions of lapse of consciousness or an episode of marked confusion caused by any condition which can bring about recurrent lapses, including momentary lapses of consciousness or episodes of marked confusion. So it's not, in that sense, the law is not specific for epilepsy, but it is essentially singled out. Includes, but is not limited to persons subject to lapses of consciousness or episodes of marked confusion, things like senility, diabetes, cardiovascular disease, alcoholism, excessive use of alcohol sufficient to bring about blackouts. And yet we allow people to drive who have more than one DUI. As a physician, you can report via this mechanism other conditions where if in the physician's best interest believes it's the best interest for the public, where it serves the public good. So it doesn't only have to be lapses of consciousness. What we do is we fill out this form. It's called a confidentiality morbidity report, CMR. And you can see at the very top is what condition is being reported. It's the same form that's used for things like syphilis or there's nothing specific for it. In fact, sometimes the questions, how long has this person been pregnant? And you're reporting a man. It's not a very specific form, but the main thing is the condition being reported. A physician who failed to report a patient is required by this law and may be held liable for damages caused by a seizure-related accident. There is case law. There are liability issues. As a physician, if somebody I hear about some patient tells me and and I think they are appropriate for being reported, and I don't do that, and there is an accident, I am then held liable. And I have deeper pockets than most people do because, the hospital insures me, or my one and only attempt at a lawsuit against me was exactly that situation when I was working at UC, because the state has big, deep pockets, and they went after me. Turned out I was the one who reported the patient to the DMV. I actually reported the person several times. This was that accident that occurred on the Golden Gate Bridge where a psychologist was killed. But I was on the hook for about a year where, is this going to happen? Is this going to happen? Then eventually they deposed me. And I said, look, here's my records. I was the one that reported this person. The guy was lying. The patient was lying. And that comes up as an issue as well. Denial and lying about whether or not the seizures. He ended up spending 4 years in San Quentin. All right, so the DMV is upon the level of your ability to fly. If you're a hack like this guy here, who used to be kind of skinny at one point, and had more hair, then, the rules are different than if you are flying for United. Pilots, pilot commands, first officers, 65, they can no longer fly. They can fly, for an airline. They can fly, private industry. They can fly charters, but they can no longer fly for airlines. The rules vary. So I want to give a couple examples. And these are, as you can see from Dr. Fisher. 30-year-old has a seizure in a dentist chair. 10 seconds after getting lidocaine, workup is fully negative. So does that person need to report? No. It's precipitated. It's a single event. It's a disorder characterized by lapses, plural, of consciousness. 50-year-old man has seizures presenting as tingling, numbness in his left face and hand without loss of awareness. No. However, you can make some variance on that. If he's so upset about this and so worried that he's going to have that it will interfere with his ability to concentrate and drive, then that would become an issue. But that's more teaching the person how to detune a little bit. 45-year-old man who has approximately 10 generalized tonic-clonic seizures over the past 20 years, but every one occurred during sleep. No, nocturnal seizures, you do not need to report because, again, theoretically, you're not driving your car asleep. Although, if you have a Tesla, and I get to playing a concert in about midnight or something like that down in Palo Alto, and I was on 280, and it's dark, and I have a Tesla, and I had it on automatic pilot. I woke up about 10 miles down the road. That was scary. I no longer do that. A 30-year-old woman has seizures with fumbling and loss of awareness, always preceded by a 60-second aura of distinctive stomach discomfort. No, a well-defined aura that would allow that person to pull over. 21-year-old man has approximately 8 seizures with loss of awareness per month, despite maximal epileptic drug therapy. Of course, there are degrees again. Now, the code is, I can say it succinctly, but there's a lot of ambiguity there. What about medication discontinuation? Do we have to report? When I started the epilepsy program at UCSF in 1986, it became very clear, because I'd been practicing out in California, that the rules were very vague and unclear. So I set up a dinner meeting, essentially, with a lot of the neurologists in San Francisco, and we discussed these issues. What about discontinuing meds? What do you tell your patients? And in California, there's something called, the consensus, of opinion, where there isn't a rule. If there's a general consensus, you can go, those are the guidelines. And essentially we set up our own guidelines. And it turns out that the guidelines make perfect sense based upon the numbers I just showed you, that if we're going to discontinue somebody's meds, what I tell them, and they say, doctor, I haven't had a seizure in a couple of years. I'd like to try and come off my meds. All right, fine. From the minute we start discontinuing, we decided, the minute we start discontinuing your meds, so you take your last pill plus 3 months, no driving. Usually the response back, well, in that case, how about we just try decreasing them a little bit, because they don't want to give up driving for that long a period. But that's unclear. Why 3 months? And I'll show you the reason why I say it. How about after surgery? We've been can be very good at getting people's seizures under control. By the way, I have a problem with people talking about curing epilepsy. there are times where we can cure people. Cure to me means you're off meds and not seizing. Controlling epilepsy, I think, is the more appropriate term. So after surgery, we still have people on meds. Down the road, they may be able to come off, but that's not the goal of surgery. But again, I would use the same measure, 3 months, no seizures. How about a focal aware seizure? New terminology, simple partial seizure, but they have a lesion, and the expectation is they're going to have additional episodes. That's unclear because it's a disorder characterized by lapses, but the person hasn't had a lapse yet. But the expectation is because of the nature of their lesion, they're going to have additional episodes. Not clear. And the last question issue is reported but still driving. As a clinician, this has come up a couple of times where somebody will, I've reported them, they've lost their license, and they're still driving. What are my legal obligations about that? I've talked to lawyers, both the DMV and the Highway Patrol and some independent people, and I've gotten every possible explanation and a decision about that makes no sense whatsoever as a guideline what to do. Why 3 months after stopping meds? Well, here's the same curve that I showed you before, that if you're going to have a relapse, it's going to occur after within the first 3 months in about 85% of people. This is a study that was done at the University of Florida, and among patients with refractory seizures, about 20% of them admitted that they were driving, which against their physicians. So that's the reason why. And one of the problems is because of the nature of the California rule being mandatory, a lot of patients hide the fact that they're having seizures, such as that patient of mine that I was describing earlier. He was having seizures. He was actually no longer my patient at that time. He was having seizures, and he didn't tell his doctor that. His doctor didn't probe hard enough, I guess. And because he was having seizures and been lying to his doctor, that's why he ended up in San Quentin. So the question is, what should a physician do when a previously reported patient with uncontrolled epilepsy continues to drive? It's unclear, and there isn't good guidance that way. So again, there are certain patients where the risk is very, very high, and we know that they shouldn't be driving. We know there are certain patients where the risk is very, very low, and and we've got ways of dealing with that. The in-betweens that's where it becomes more art than science. But again, it's the DMV who does that art, not us. All we do is there's a form that we fill out. If you say to me, I want to try driving, I tell you, go to the DMV, talk to the health and safety officer at your local DMV office, get that form. We'll fill it out together and see what they say. By the way, on that form, if you should do this, one of the major problems that occurs, you get it, the form, you mail it to me or your clinician, I mail it immediately back to you because at the bottom of the form, if you don't sign it, I can't do anything because I'm releasing your medical information to somebody else, and I can't do that. It's a HIPAA violation. So until you sign that form, I can't do that. All right, so here's a medical causes leading to crash deaths in the United States since 1997. Seizures, 97 out of that. But look at that. Alcohol related, 12,000. Almost 13. Other medical causes. Young drivers, 10,000. The driving accident rate in the U.S. for women with epilepsy is lower than that for men without epilepsy. Let's be completely honest and fair about this. People who had, multiple DUIs, why do we allow them still to drive? We know that their rate is about 12,000 times or 12,000 times greater. If we truly were being honest about this, we would not allow male teenagers to drive till they're above 21 or 22 when they actually myelinate their frontal lobes and actually have a conscience. Seriously, because if you take there are certain pockets of numbers, if you pull them out, alcohol use, male drivers who are abusing coming across the bridge. I was probably doing 75. And somebody passed me like I was sitting still. It's a young guy in a hot car and he just blew by me. Common sense is a rarity in that population. So in conclusion, every state has regulations that regulate driving in epilepsy. The odds are slightly higher, but certainly less than other conditions. People with frequent seizures obviously should not drive, and it varies from anywhere from 3 months to 24 months of seizure-free requirement to be before you can get your driver's license back. There are individual exceptions that can be considered, but those are there are the known ones I've already given you. Other ones that you need to discuss with the DMV. Bob wrote this. This is obviously one of his slides. It's tailored. Regulations are improving. I wish that was the case. It's not the case. There was a law before the state legislature. It's gone through all the houses and so on, and where it would change it to patient reporting, not physician reporting. My understanding is that the governor didn't sign it. So things have not really improved all that. I'll be glad to take an occasional question at this point. You can't dazzle them with brilliance, baffle them with bullshit. Is that what?
What about the soon they'll be driverless cars? Will that be a move?
Well, do you need to have a license if it's a driverless car? I mean, you can call Waymo, you can call Uber or Lyft. They do all those same things. Yeah. Oh, I'm sorry for the drivers. You're still going to need a driver's license. I mean, my plane could fly from here to my kids up in Portland by itself, but what happens when that doesn't work? Yeah.
Level 4 comments. What do you think about this?
The question is, what do I think about self-driving modes in cars? They're, at least in the test, it's listed very clearly. It's driver assist. It's not even though it's advertised, self-driving. I have that option on my car. I've never used. I'm afraid to use it, to be honest. No, it says you still need to have the ability to take over control of the car in situations. I've had the driver's assist part going at times, and I've come to a situation where there was a split in the road, and it's always taking the middle one. So, you have to be aware, you have to be awake. Now, what's interesting about it, there have been reported cases with, driver's assist where they're driving, somebody's fallen asleep. And you can't raise them. So the highway patrol is kind of pulled in front of them. And the idea is with driver assist, if the car in front of you is slowing, it slows you and it keeps slowing. So they kept doing that until it came to a stop. Sort of like that Waymo that had somebody put a cone on front of the car and it wouldn't go.
Traffic.
Yes.
Your life particularly can be pretty life changing.
Yeah. Yeah, please, Natalie, please.
Yes. One more in process with Waymo, obviously, because I got to get people with rides. But if you go to Uber, there actually is a section of the website that provides rides for people with disabilities. As there are shared options available, I would be absolutely happy to share that information with you. I'll leave my business card somewhere at Epilepsy Foundation and Clinical if you want more updates on what I shared. So I know how important that is. Also, nonprofits like the Epilepsy Foundation sometimes do spreadsheets for the ride shares with so many people all with each other. There's certain events. And I think hospitals themselves sometimes have programs for people to get access to doctor appointments or
Yeah.
just hospital.
But that's different than when, when I don't see new patients anymore. I give them to Catherine and Teresa. But when I used to see a new patient, they come out of the emergency room, they had their first couple of seizures, they get sent to me. I wouldn't, I would hardly ever talk about driving until the very end. Because if you say, I'm sorry, you're not gonna be able to drive from the very beginning, they don't hear another word after that. Now, so in terms of doctor's appointments, yes, but the major problem is, how am I gonna get to work? How am I gonna get my kids to school? How am I gonna do this and that? And unless those our options are free,
Yes, so that actually is a great point where I will bring up paratransit. Paratransit isn't always free, but it is at a low cost and can provide at times door-to-door service or pickup service from where the public transportation will drop off or pick up and drive directly to another location. So I would urge you to look at your county's paratransit options and or contact me and I can do some of that for you.
And check with Waymo. We have a friend who works for Waymo, and I believe Waymo may have a program. I believe with Waymo, they may have a program where people with disabilities can ride for free if they're in an area that they service. They're not currently servicing the entire Bay Area.